Greetings, everyone, once again. Welcome to the 138th session of the online Optum Learning Series OOLS. And for today's session, we have with us Optom Pooja Singh. She is a consultant optometrist who graduated from the All India Institute of Medical Sciences in New Delhi, India in the year 2009. And from then on, she has been practicing specialty contact lenses for about 9 years. She also joined the contact lens research unit as well as the low vision aids lab at the Ames University in 2009. And she was a consultant optometrist for both of these super specialties or subspecialties. She has worked extensively in training optometry students, postgraduate resident doctors in the field of contact lenses, and she has also been associated with several organizations to start some introduction course contact lenses as an instructor. She has a keen interest on research, and she has been writing multiple theses and research publications with that regards. She was also been nominated as the Diva of the Week by Optometry Diva Program United States in April 2020. And she has worked very closely with Manicon UK, being the Rose K2 co-educator for Manicon UK since 2012. She has won several awards, and the list, I think, can go on and on and on. But most importantly, she was recently awarded with the Forever Star India Award, which recognizes real superwoman for the category in the health and wellness for the year 2020. So commendable. I think she has represented the country at an international platform as well. And she has a very keen interest, as I was mentioning, in terms of contact lenses, anterior ocular surface. And as per the topic goes today, dry eyes. She's been very instrumental. She's actually in the midst of planning to set up, and her talk basically revolves is she want to let everyone know about how to set up dry eye clinic, what are the options available when you want to go up and set up dry eye clinic. And she's going to take us through a very interesting talk regarding dry eye spa. So welcome Pooja onto our platform, and let me just leave the screen time to you.
Hello everyone, and thank you Fakhruddin and the entire OOLS team for in fact giving me the opportunity to share my views on something, on a topic which is totally new. And if I talk with respect to Indian scenario, it is absolutely a new thing. So good evening everyone for joining me on this. And I know it's very tough to join on a lazy Sunday and that evening. Okay, so without wasting much of a time, I would like to start. This presentation, first of all, I would like to give a small gist. This presentation is basically about how to integrate dry eye clinic or a dry eye spa in your independent practice. If you are an independent practitioner, or if you're working with some sort of a hospital where you can evolve and integrate this dry eye clinic also as a small excellence center as well. So this is about how you can just integrate a dry eye clinic along with, and how you can train your staff. This presentation will basically deal about some deep cleaning methods which an optometrist can independently also perform. It won't deal with the tests which are involved, how to check dry eye. It won't also deals with a very advanced level of instrumentation, how to detect dry eye, but it will deal with the treatment that we, an optometrist in an Indian scenario, can easily have a good number of walk-in, and which can also make and help ourselves in standing a different and edge from the competitors. So let's start with the second one, that's a prevalence dry eye Indian scenario. Let's have a small discussion also about what is the prevalence of a dry eye situation if we talk about the Indian scenario. Earlier, what happened that dry eye was basically no longer, it was limited. Earlier, we always had this norm that dry eye is mainly because of the aging. But because of the research that has been going on, increasing number of younger individuals who have a lot of online work as worldwide are affected with the DED, and India is no longer an exception. Dry eye has various causes. It not only affects the vision, but it also imposes various limitations on the patient. There was a study which was done in India which found out that the onset of dry eye disease is now early in men, recorded as compared to women. In men, the age of the disease was onset was in early 20s and 30s as compared to 50s and 60s in women because of the hormonal imbalances. Age, urban residence, occupation, socio-economic affluence, lifestyle are one of the very high risk factors for developing the disease. We all are aware of this, that what can be the cause. It can be because of the insufficient production of tears, instability of the tear film, which can be evaporation or the mixed type. There are various causes, and much of the presentation must have been taken on this topic. Dry eye disease not only affects your patient vision, but it also disturbs their quality of life, causing anxiety. And in few of the cases, I've seen that patients are totally depressed if they have to wear contact lenses throughout their life in cases of irregular corneas and so. So it also affects their professional as well as personal productivity. However, if we detect early dryness issues and we also treat it in a very appropriate manner, because most of the time what happens is that we know that the patient is suffering with dry eye and the patient is taking self-medication of the over-the-counter. But if we treat the patient with the dry eye in a proper manner, the patient can lead a very normal and a symptom-free life. Sometimes dryness can also be associated with medical conditions like arthritis, which if neglected, it can also lead to irreversible visual impairment. Therefore, it is very, very important that the people, eye care providers, optometrists, as well as the students and optometry practitioners, those patients who are at risk of dry eyes, particularly the urban corporate place workforce, they should be screened for this condition and they should seek timely relief. So, yes. Now, these are few of the tips for Dry Eye Excellence Center. See, what I want to convey here is that if we want to have a small dry eye clinic at our independent practice, so most of the time we all have worked as an intern or we have worked as an employee at some of the other places. But there you must have seen that dryness is, whenever we are taking history, the history always of the dryness, it is never asked from the patient. Patient abruptly says, yes, I have a dryness thing, please sort it out. And that dryness thing, the issue that the patient faces becomes a secondary thing, and cataract and surgeries and contact lens, it becomes a primary thing. And then what we do is, if the patient is suffering with a dryness, we subject the patient to a lot of tests. Like example, if we talk about the basic is at the cornea with a fluorescein one, conjunctiva with the Leesamine tear breakup time, we have the advanced, which is called the tear osmolarity, and so on. But what I mean to convey here is that, yes, we have a good gold standards of test, but what about how you can implement? That is the most difficult thing, is how you implement a proper therapeutic strategy, which should be the basis of a dry eye spa concept. It's just not like that if we have a completer project, so we take a random patient from LASIK or from cataract and then we do a study. No, we have to evolve. Just like we have a contact lens specialty, we can also work on having a proper dry eye. Why what spa I have added? Because I've seen that spa is basically massaging. So when patient have a very cool look to it, okay, and you can later on to advance it, you can also have a tie-up with your local or a neighboring ophthalmologist as well. So this is an evolving dry eye landscape, and as I said that. If you have a proper setup with all those things, then definitely it will generate good amount of revenues. Yes. And there are a lot of research and there are a lot of material available on the internet where you can also guide your patient. And in fact, now the patient himself comes and says a lot about the dryness issues. So what I want to say is that apart from guiding patient for contact lens and for spectacle, your third option should be to maintain a proper file as well as the protocol for dryness as well, to increase the walk-in in your clinic. So are you dry eye patient satisfied if they're using an over-counter drops, if they're on steroid, and are you facing the contact lens dropout issues? So these things, if you talk about these things to the patient, definitely you will have multiple number of patients coming to you and expressing the discomfort that they are having on a daily life with the dryness. And they don't have a permanent relief to it as well. Okay. Look at your current dry eye patient, as I already said, how you have to motivate the patient, how you have to convince the patient that apart from these drops and apart from steroid, we also have some deep cleaning methods. Now, we also have some instruments available. In fact, in India also, which is also within the budget of the optometrist. Earlier, there are cleaning methods which are available, but they're very expensive. But now the company has come up with there are many companies, and they have come up with certain things to help the optometrist also to have a small setup. So look at your current dry eye patient, and as I said, that dryness is something which has to be discussed with each and every patient, and it has not to be taken lightly, that you can simply write a simple eye drop on the patient card and say, okay, put it over the contact lens, you come with it, it's a very good eye drop. You really have to examine the lids, you really have to determine the cause as well, which we as an optometrist can do in our clinic if we have a proper slit lamp as well. Again, as I said, that surgery also impacts dry eye. There are many cases. And to increase walk-in in our clinic, we can have a tie-up with the ophthalmologist who sometime what happened, the doctor refers patient to us and say, yeah, this patient has a chronic dry eye problem, and I really feel that the patient needs counseling. Can you give time to such patients? Yes, definitely we can allow a time to such patients, because these patients definitely need a proper counseling and the treatment, and we can allot some sort of time to such patients. Advantages of establishing a dry eye center of excellence. If you're working in a very good hospital and you feel that you have a very good team, we have a good staff, so there you can have a small, you can establish a dry eye center of excellence in collaboration with the interested companies, or you can have yourself, because as I said, it generates revenues. It also enhances the surgical focus. It also differentiates. You stand out of the box, right? Because now you have an additional specialty to deal with, and your patients will be happy. Again, dry eye clinic is a premium or a necessary medical service. If you are an optometrist and you feel on expanding your clinic, I will definitely say that you can convert it into a necessary medical service. Now, it also depends upon the budget that you want to involve into. Initially, you have to take small baby steps. Initially, you can invest in a small apparatus and instruments that can definitely help you in deep cleaning things and can also increase your walking. And with the time, your budget, you feel that there is a profit. Apart from that, your patients are satisfied, they're spreading the good word about you, then you can also invest on big instruments and devices. Dry eye clinic is a facility. 20 to 30% of the OPD patients that if we have work in your hospitals, we complain about the dry eye symptoms, as I said, and we as an optometrist can have earlier also dispense patients and also treated patients who had blepharitis, who have meibomitis, and so on, those small issues with the eyelids. Okay, so in that case, now you have to upgrade your system. And while upgrading, why not to involve a proper clinic and a setup where we are known as a dry eye expert as well. Okay. The first slide which I have added here is about an eye spa. It is a separate thing. It is not about my presentation or dry eye spa thing. Eye spa is in 2 minutes, 2-drop handy eye drop, which is available over the counter for dry eyes. It has nothing to do with the dry eye spa. Dry eye spa basically will treat those who suffer from the meibomian gland dysfunction, because it is one of the main culprits which causes severe dry eye problems. And most of the time, it gets undiagnosed as well as untreated, and the patients are most of the time unhappy. The entire basis of what I want to say about the dry eye spa is basically to give value to the patient with a comprehensive acute and prevention and maintenance treatment that will basically also help you in treating the specific ocular disorders at hand. These are a few of the touch points of a dry eye clinic if you're planning to have in a small scale. So if you have, what I request you to have a walk-in, especially for a dry eye patient, it should not be in that case, that if a patient comes for contact lens, then in that case, on that same day, you are doing a dry eye checkup. No, if a patient has come for contact lens, then treat contact lens as a specialty. And if you want to have a very good practice, then enroll patients specifically for a dry eye clinic days. You can have 2 to 3 days allotted in a week for especially for treating the dry eye patient. In that case, patient will also come to know, yes, this is not a normal thing. This is a serious problem. And if I don't get treated, then in that case, definitely I'm going to have a lot of problems later on because of the lifestyle that we all have. We have to work online. We have a lot of computer work, especially children as well these days, right? They have a lot of screen exposure. So in such a cases, I really recommend you all to involve such things in your practice. And then see, the thing is, if you are integrating such things, so you cannot do everything on your own. You need to have a small team in it where you can have 1 or 2 staff and a proper detailed history of the patient, refraction of the patient, counseling of the patient, history of what medication the patient was on, any systemic illness. These all things should be properly recorded. Apart from that, if you get a patient referred from any ophthalmologist, then you should also have a detailed analysis of what history and what treatments that the patient has basically undergone there with the doctor that has referred you the patient. And then we have the after you can also have a very small test as well, where you can just detect what sort of dryness is there, what is the treatment, what will be your first stage, should I prescribe eye drop initially, and what should be your examination. If you have a doubt, you can also take help from the ophthalmologist as well. And after the confirmation of the dry, okay, after the dry diagnosis has been made, there are multiple questionnaires available. We have gone through them when we were in optometry colleges. Whatever suits you best, you can make the patient as well as you yourself fill, and your staff should also be aware of the questionnaire available and that you are making the patient fill. Confirmation for the dry eye treatment. Okay, and after that you have the opinion. So the gist is that the patient, that everything should be done in a very much systematic manner, and the main focus should be on the treatments, like educating dry eye therapy as well as follow-up. It should not be in that way that the patient comes for the treatment, you did the treatment, and then it's okay, no follow-up and no calling of the patient. If you are in a private thing, then definitely you need to maintain data. Apart from that, also you need to follow up the patient, call the patient, connect to the patient, and you have to also convince them what is the need for the follow-up. In many of this in many of the cases when I was working in a government hospital, I've seen that apart from patient, many of the doctors were like, okay, it's okay, it's a dry eye thing, we have rush and okay. But if the patient are actually educated about what problem they are having and how we are going to treat it, definitely the patient will turn for the follow-up, right? Yes. Now, before I start with the deep cleaning thing, I really want, because there are some students as well, I feel, so we can have a brush up on what is blepharitis and meibomitis. These two are basically medical conditions of the eyelashes as well as the eyelid that can cause itching, redness, irritation, blurred vision, and eye pain. So these conditions are basically associated. Sometimes you may have a very dry eyes, and sometimes you can also have a very watery eyes. Blepharitis is basically an accumulation of a crust, dry or a dead skin cells in the eyelashes and their base. And sometimes bacteria can also, on that skin, can infest the eyelashes. Whereas in meibomitis, it is a condition where the glands that we have in the eyelids, near the eyelashes, they become plugged with the solidified oil. And these glands normally, when they're functioning normally, they produce a very free-flowing oil or lipids that we say. But when they're diseased, then they start producing an unhealthy waxes, or you can say in a layman language, that can cause the gland to become choked or plugged. Then we have anterior blepharitis and the posterior blepharitis. And anterior is something which occurs on the outer margin, right? So, and if you talk about the posterior one, it basically occurs when the glands of the eyelid, basically, again, there is a dysfunctioning of production of the oil, which definitely creates a favorable environment for bacterial growth. So there are many things with this. Then, as earlier in our clinic, we have been advising about the home remedies for the blepharitis, warm compression. In case of severe pain, we have also, exactly. Now, if I talk about the warm compression, everybody must be aware of it. We advise that how to dip a clean wash cloth in a warm water, a lukewarm water. And sometimes I've also seen that the patient have been advised not to use water. You can just use your handkerchief just iron it and create a warm atmosphere. You can wipe it out and place it over your closed eyelids for a couple of minutes. Sorry. Repeat 3 to 4 times, and you can clean any oily debris or scales collected on the eyelids using a clean cloth. But I would also recommend that if the patient is very much regular with it, you can also advise patient to use an anti dandruff shampoo as well. They are in these 4 oils which have been mentioned here, right? The tea tree oil, omega-3 fatty acids. The studies are basically going on, and we don't have a confirmed thing that they will basically and definitely help. So it's just for this, you may have these oil also, because in some of the studies I went through, they have said that coconut oil is very, very effective. But applying an oil into the eye, until and unless we have a proper data where 1,000 patients have been studied, I cannot recommend this. So now we have the scrubbing of the eyelids. Okay, so add 2 to 3 drops of any mild baby shampoo in 1 cup of warm water. Dip a clean cotton ball into the solution. Use it. So see, these things we have been doing it, and I guess everyone is aware of it. And most of the patients are also have been recommended this practice. But sometimes we really feel that the patient are like, I'm not comfortable with these things. It's just like every 3 to 6 months I have the same problem, and I don't have time for doing these things. So do you have something which is much better than this, right? Yes, again, the same thing that we have advised patient earlier: warmth, massage, and cleaning. These 3 major steps which we advise when we have a patient with the blepharitis thing: warmth, massage, and cleaning. But remember, these things should be done off the contact lenses. If your patient is a contact lens user, he or she should not be using contact lens and then doing the 3 steps. Okay, this is a video of one of the latest thing that I thought of adding it here. It's from one of the company called Meebo. It's a heating pad, and it is available in India as well now. So if anybody is interested, they can just drop me a mail. I'll let you know. But let's have a look at the video. That the patient can use these heating pads easily at their comfort of their home. So we can advise these, but the only thing is that you have to diagnose the patient, you have to see what level of dryness is there, you have to give a proper demonstration to the patient, and then only you can proceed. The second thing is, since I have only observed the demonstration, and so I can't just comment on how effective it was, but seeing the research and the data available, I really found some of the patients were very happy. But you have to decide on what sort of patient that they can comfortably use and what duration. So these sort of things have to be explained properly to the patient. Then we are redefining dry eye therapy. The 2 important things, if we are integrating dry eye clinic in our practice, is again the treatment of the meibomian glands, and the second one, or the lid hygiene. Lid hygiene is very much important, as what I feel, just like as I can say that brushing and flossing at home of the teeth will also help you maintain the oral good hygiene. But that is also not enough. You still need to go to your dentist after every 6 to 12 months for a thorough checkup. So similarly, in this case, I really feel such patients. So taking care of a dry eye is like taking care of a teeth, as I said. But for eyes, we need to explain our patient about the daily lubrication and the warm compression at home in cases of very mild forms. And we can also fully clean out the meibomian glands from time to time. Okay, so, and there have been few advices which I have mentioned as a deep cleaning devices from the dry eye, because they see, dry eye discomfort in such patients basically stems up from the blockages in the tiny oil glands around the edge of your eyelids. So these so-called glands, they will give you tears, a protective oily layer called meibum. And these meibum, they keep your tears from drying too. But in patients with a dry eye, it starts to thicken up and it clogs the gland. So we have various deep cleaning devices available all around the world. There are very few which are available in India. We have LipiFlow from 2 of the companies. We have TearCare, we have Ilex from Elcon, we have Meebo Thermal Flow, iPress. These are available, and few, for example, LipiFlow, Ilex, and then we have the Meebo Thermal Flow Intense Pulse Light Therapy. They have been, especially intense pulse light therapy. I've seen many of the doctors, ophthalmologists, they have started integrating into their own practice. Apart from that, they are now we have one company which is a distributor which has started. If you have any query about the Mevo thermal flow, and there are few of the devices which are still yet to launch in India. So let's start, and not much, but I can just help you and explain you so that we are aware of the things, the upgraded technology about how to integrate such things. If you talk about the LipiFlow, the very old one was from Johnson & Johnson Vision. Here, the shell-shaped applicators. I'll come about the thermal pulsation, how is effective, and I can explain this in the next one. Let's first start with the LipiFlow and what is the mechanism of the LipiFlow. Shell-shaped applicators are basically placed over the front and the back of each eyelid. And a computer, a software, it delivers the heat and pressure to the applicators to massage the glands and release the clogged oil. And we have to use a numbing eye drops also before the treatment. And studies have suggested that it reduces the dry eye symptoms for 6 months to a year with a minimal side effect. Some of the patients, they have experienced minor redness, which basically goes away after treatment. And because of the applicator shape here, this device is not ideal for patients who have deep set eyes. Apart from that, what I can add on it, it uses a sort of heat, right, which is applied to the meibomian gland in the eyes to remove the blockage and encourage the flow of natural lubrication. What this means is that machine will create a pulsating massage-like motion. That is, again, to further ease any blockages. And it gives a very comfortable feeling to the patient. Patient basically find this massage feeling applied to their eyes difficult. Sometimes they find difficult to tolerate, but then most of the patient which really find it's very soothing. Okay, then we have the LipiPro. But yeah, and one thing about LipiFlow is that it was earlier very, very expensive. So it was at very few places. Now the price has reduced, but I'm not sure about how many doctors in India currently using it, and in which of the hospitals or tertiary eye care center where I've seen LipiFlow. We have this the second thing, which is called LipiPro. It is very affordable. It can fall under an optometrist budget as well. And LipiPro can be used in case of an uncontrolled blepharitis, where proper lid hygiene is very much important. This will include a specific eyelid hygiene products. And in some cases, if you feel that the treatment needs an antibiotic, you may prescribe it. It has to be used with a very precision and attention to the detail you'll see in the video. And the very compact design of the LipiPro, it basically allows for very comfort while treating both the upper as well as the lower eyelid. Yeah. Next is about the eyelids, which I really found when I was just searching the internet about one of the hot treatment, how to treat a dry eye and MGD. And many have done a lot of paperwork also on it. iLux is basically by Alcon, and here the eye care providers basically can use it's a handheld, right? So it's a portable device again to heat and massage the eyelids, and it is LED based. Heat and gentle pressure basically work together to release the clogged oil. This device is best used to treat problems on individual eyelids. Patient can expect results comparable with the LipiFlow as well as the tear care, but the cost of the treatment is also similar. But that means that these eyelids as well LipiFlow, these are expensive, and one session, in fact, it goes around. If you talk in dollars, it's around $400. So definitely, if you inculcate these practices or these devices, then these sessions, the patient has to pay for this session. So before, if you really feel that your patient is comfortable enough in spending a good amount, then these things can be used in our practice. Again, it's a similar thing. We use a drop of numbing eye drop. Disposable silicone pads are inserted behind the eyelid. Heat is again applied to the affected area, and this allows the melting substances which could be obstructing the granular ducts to be dissolved, and there's a sensor in it which can continuously monitor the internal eyelid temperature during the treatment. Finally, the eyelid is gently compressed as it is needed to clean the granular ducts as well as express whatever the residual substances are left over. So it basically helps you to control the level of the heat and the compression with the single buttons. And more detail, we have a very good videos on YouTube. So if you really feel, you can just log in there and can have a look. Then next we have the Mevo Thermoflow, which is also available in India. and it is a cross between a LipoFlow and iLux. This system basically includes, again, a power console, a wired handpiece, and a metal iPads, which can be placed over the iLux. The console that I'm talking about basically provides heat, while an eye care provider like in us, it manually massages the pads and over the eyelids to release the clogs in the meibomian gland. So definitely it is a massaging type of thing, and patient really feel very much comfortable, barring the few which might have a very odd sensation which they cannot tolerate, right? Meboflow therapy uses thermoelectric radiations, which produces a heat of around 108 degrees and works by liquefying the dried up tears and stimulating the meibomian glands in order to encourage them to produce a greater volume of tear film, which remains on the surface for longer time, keeping them lubricated and more comfortable. Again, it's a non-invasive thing, and many patients I have seen in the demonstration, they basically enjoy the soothing massage action and the spa-like nature of the appointment. You can have multiple session depending upon the treatment that the patient requires. They'll also find that they start to see an improvement in their symptoms immediately after the treatment, and the benefits are basically long lasting, providing extended relief from dry eyes. There are various advantages of the Meboflow, and it does not cause any sort of corneal distortion, which is something often seen in other type of lid-based therapies. So it gives a very good result. So, and it is also typically less expensive than LipoFlow. This device may require more frequent sitting of the patient, right? And the cost of the therapy of ranges between $100 to $400. Then this is also one of the instrument which I came across, which is commonly used. I'm not sure about here. iPress eye hydration system. It is by Holber Medical Product, and here again, the doctor or the optometrist, he or she will cover your eyes with the goggles that contain a soft gel insert, okay, and attached to the heating device. And these goggles will basically fit over your eyelid, and they are warm to soften your meibomian. So then the optometrist or the ophthalmologist will then massage your eyelids to release the oil. This therapy will definitely require your patient to have around 4 to 6 sessions, scheduled 3 to 4 weeks apart. And again, the session basically, it's an expensive one. It ranges between $450 to $650, right? Next is the intense pulse light therapy, which I've seen that many ophthalmologists have started using it. Okay, and it's from the various companies. Intense pulse light therapy it's one of the FDA approved for more than 15 years to basically treat the dryness, remove the skin lesions as well as also address other skin problems. It is also used off-label to treat the meibomian gland blockages. So what happened during the session, an infrared light is basically applied direct to the eyelids with a handheld device. And this light, it helps to reduce the inflammation and loosen up clogged meibomian gland blockages. Some say that this therapy is not for darker or pigmented skin. The treatment takes 10 minutes and it needs to be repeated around 4 times per year. And it costs around $400 per session. Now, about the intensity of light and all these things, it was varying. Because this instrument is from the various companies, right? So in that case, I have not mentioned it here, but definitely I have seen that intense pulse light therapy is effective, and those patients which I have met, they were very much happy with it. And but the only thing that I don't have any idea about the optometrist performing this. I've seen doctors doing it, right? And okay, now this slide that I've added is about for an Indian optometrist as a practitioner, if they want to inculcate a dry eye clinic into their practices, because these devices which I've mentioned here are available in India. So if you really need them and you want a detailed brochure on them, then definitely I have mentioned my mail ID, and I'll connect you with the company people, and they can give a demonstration to you at your place, and you can have your queries solved. So first one is a lid hygiene one. That's called a Mebo Lid Pro. Then the second one is a meibomian gland treatment that I talked about, which is a Mebo Thermoflow. And the post-therapy, we can also have the MGT preservation, that's called the Mebo and iPad. These are the questionnaires which I have mentioned, because there are multiple questionnaires which you really feel comfortable in adapting into your practice depending upon the diagnosis of the patient and the treatment that you follow. It will be very helpful for all the students who have joined you to just browse these questionnaires. Just go through them and see what type of questions are basically asked when you are working in a hospital or when you're working under as a freelancer as well. You should definitely know how to take history of a patient. And if you are very much into the dry eye thing, then definitely you should know what sort of questions can be asked depending upon the symptoms as well as the signs. This is again the gist of how to get started. And if you have a team, it will be very good. And you should have a very detailed protocol, a proper management thing, that what type of forms and what type of products also which are available. Then you can also have a brochure thing which can be circulated among your team, and it can be put on the internet as well, and it can be distributed to the patient while you are handling one of the patient. Other patient who are in the waiting room can have a look at the brochure, what treatments are available and what upgraded treatments are available. Apart from that, how to maintain a follow-up data of the patient, because now you will be integrating this into your practice. So how to maintain the follow-up data and all these things about how to inculcate a very good effective practice. So it's about that, those small baby steps that you will be taking into it. Yes, again, the step one, that is specific symptoms identification when a patient comes into your clinic. Step two is key medical signs investigation with the routine care. What care and treatment that the patient requires. Step three is again the dry eye testing as well as the follow-up. So you can divide your clinic timings into a very systematic manner, so that if you have a good number of walk-in, then every data and detail is also maintained, and later on these records can also be used for a paperwork in future. Again, the take-home message when it comes to a follow-up visits with the ocular surface disease patient, severity of the symptoms should dictate next steps. Touch base on medications and treatment plans by asking patients how they are going and keeping visual outcomes at the forefront of the conversation. Understand the treatment that may require more frequent follow-up. Definitely, we may have come across many patients who feel that just at one visit will solve their dryness, but this in such case is not the scenario. Your patient definitely needs follow-up, and with these follow-ups, the patient's severity of the symptoms will decrease. So again, the gist is that you definitely need to have a proper counseling session with the patient, and the patient should be thorough and very crisp and clear in mind about the treatment that the patient is undergoing through. Thank you so much. And I've mentioned my 2 email IDs. And if anyone has a problem or a query, and if anybody wants to, start a dry eye practice and wants a link how I can help them to start it, then in that case, definitely please write down to me at any of one of these email IDs. I'll be glad if I can help you guys. Yeah.
Great. Okay. So thank you so much, Pooja. I think this is a very comprehensive presentation. I think it's more of letting people know what's available and how to start, and
right.
It's more of a motivation kind of a talk, whereby we want people to start because it's the need of the hour. And
right.
Thank you so much for doing that. Again, just for the records, neither Pooja nor we have any financial disclosures for any of the products, right? So this is just, we want to connect you to them so that you can get, and basically it's just for you to be aware that these things are available, and you can go ahead and look out for these particular instruments, which will be very beneficial for setting up the dry eye clinic. So there's one question which about the fee structure. Different instruments, have different kind of fee structures, because it depends on the cost of the instrument and the number of follow-ups as well, right? So it varies across different instruments. The question here asks that do you have any fixed plan for such dry eye clinics? Like, for example, if you have a patient who has a moderate dry eye, will there be different charges or professional fees compared to a patient who has severe dry eye? So do you have some thoughts to add?
See, as the demonstration that I've attended and I've seen ophthalmologists performing it, what they have been doing is that they have kept the session charges same, whether it is for the moderate or for the severe dry eye, because for them, it is about the apparatus and the involvement of it, right? And the services. But yes, what I have seen, see, the thing is, it's about the goodwill. It's just like that if you come across a patient who has a moderate dry eye, and the patient has a lot of complaint and awareness of it, that the patient has always a foreign body sensation in the eye, then in that case, after a proper counseling is done, you can start with a basic steps. In such cases, you can charge in a very small amount. But if your patient has been referred by an ophthalmologist for a particular test, then definitely you need to put on that charges. Yes, what I feel in India, it is not covered by the insurance thing. So in that case, what I really, as I mentioned earlier also, you can begin with these small basic instruments that are within your budget. And with the walk-in increasing it, then you can, and there are one more thing, few of the companies, they can also provide you instrument on such a basis that you can also pay if you feel that the session charges are patient is unable to pay it, then you can also pay the instrument charges in a small EMI form. So that can also help the practitioner as well. But yes, since if these things are coming into your practice, when you see your surrounding people also doing it, then they can be a standardized charge. But as far as the literature which is available on the internet, I could not find what are the fixed charges in India. But the charges that have been, that have been taken by the optometrist, and it has ranged in around $150 to $450 and so on. So the session prices are still varying. So I cannot much comment on that.
Yeah, and I think the one good point what you mentioned during the beginning of your talk is like, you can dedicate a day for a dry eye clinic. And then,
Right.
let's say, for example, one day in a week, just an example, that Wednesday is your dry eye day, or you can call all your patients. And then you can, as you were saying, some companies loan you the instrument for a
Yeah.
day, and then you can get all your patients on that day and do the treatment. And I think this is done quite often in ophthalmology, whereby, when they want to do the YAG lasers, post cataract capsulotomy, YAG capsulotomy, they loan that instrument for a day,
Right.
and then all patients come in and do. So I think that particular technique would work, and nothing is stopping you from doing that. So that's a very good point as well. Yeah. All right, let's look at some questions here. I'm just going to share them with you. Any experience on thermal pulsation system and its effectivity? I mean, you have not started really, but anything you would want to add on this?
Well, the thing is that I am a very much beginner, but what we can do is we can have a very good presentation by someone who has been doing cases. And there have been very few good doctors I know who have started doing this. But the thing is, since I don't have that much of a experience of seeing the patient and what was the outcome. So in that case, I really feel that and yes, yeah, and how much thermal pulsation is effective? Yes, in this case, what I want to add on is that since this technology is varying from various companies, so I could not find a standard data on this. And if I could find a standard data of about how much is required, so definitely I would have added in my dry eye treatment presentation.
Yeah. So I think clinical evidence is there, but
Yeah.
this evidence, as you are saying, people
See,
are
all
doing.
the research, yeah, all the research which I came across was in fact abroad. But in India also, I've seen many doctors are doing it, but still we have no paperwork, a proper paperwork in North or South or what. So if till by the time that comes, and since we have many companies who have their varying range, so I really, that is why I think I did not add it up while making the presentation.
All right, great. So that's very helpful. And then the other question is again related to the instruments and all the available technology we have. Would you want to comment on will any instrument be useful for aqueous deficiency versus evaporative dry eye?
Yes. The initial one that I discussed about what you can say, if I talk about the evaporative dry eye, in that case, you can also use LipiFlow as well as the MevoFlow. Because while I was working on it, there were many questions also by the optometry students that, ma'am, if you're starting a clinic as well, then in that case, for an evaporative dry eye, you can effectively use a LipiFlow as well as the Ilex can also be used. And if you have, see, the thing is, if you have to differentiate between the evaporative dry eye and the aqueous deficient dry eye, so you cannot keep a different instrument for each of these. So in that perspective, you can have a very common one. And in fact, in such case, I really feel that if you go for LipoFlow or the MevoFlow, that will definitely help you. But in some cases of evaporated dry eye, sometimes you cannot start a session at the first visit of the patient. You can also treat the patient by some lubricating drops, and then after you feel that the follow-up of the patient is not comfortable, and if you really feel that definitely the patient needs counseling of the session, and maybe by upgrading the technology of the treatment, in such case the patient can improve, then definitely you can go for the advanced thing also in case of evaporative dry eye.
Yeah, that's very important, and I think I would just reinitiate your own point where you were saying that patients should be informed. So patient must be aware, and the
Yeah.
treatment could be splitted. So this is what my knowledge goes. I think evaporative dry eyes is more associated with meibomian glands,
Right.
right? Those can be done in clinic, whereas aqueous deficiency is more towards prescribing artificial tears. So patient can do that at home. Probably that would be some kind of logic which we want to strike a balance between the two and something like that. And yeah, I mean, you said rightly that no instrument can probably have that. I will only treat aqueous deficiency, or I will only treat,
Yeah, as a private practitioner, you cannot differentiate, okay, this is a patient, I don't have this, so I'll do this. Okay, fine. You have to have a balance in such a case, and you cannot just advise patient about what is evaporative dry eye in front of the patient. So you need to have a balance over this. Yes, the team of yours, the team of the private practitioner should be able to identify it, and then they can direct the patient to you. Okay, ma'am, this is the patient of ETE, or this is the patient of ADDD, and how to begin with. Right, because patient won't search that they have evaporative dry eye or ADD, and if you only have one, then you have to chalk it out how you have to maintain the balance. Right.
That's right. Great. And let's just take one last question which just popped in. Some of the instruments require us to put local anesthetic, like
Yes.
Hurricane. Do you think that would be something of a concern as the primary eye care? We do have, like, some of the countries, I mean, most of the countries, let's say what attendees are from us here, they do have this kind of a problem whereby there is some restrictions in the use of drugs, right? Diagnostic as well as therapeutic drugs. So do you think that could be something which we need to also look at?
Well, yes. In such cases, I have seen a few of the practitioners, they were avoiding it. Like, for example, yes, but the thing is, if we are setting up a clinic, we have to properly follow the protocol of the instrument that we have purchased, right? And if you see in every of the brochure of these instruments, they are specifically mentioned that you have to use the numbering eye drop. And then if you see the videos, those videos on the YouTube, even there I've seen that they have used it. So now this is something which I really need to work. When I can just see my patient, I can have few patient on the eye drops, few patient without the eye drop. For example, in case of contact lenses also, if we talk about, we are always advised that I've seen that if you get a very finicky patient and the patient has a very much problem with the foreign body sensation, you can use Paracane as well. But in my practice, I don't use Paracane. I know that the patient basically feel problem, but I do explain them that this is for your own benefit as well. So see, this is the thing that we have followed it. I have my experience. But in such cases, I really feel that if I follow the protocol that has been laid on by the company, then in that case, they have specifically mentioned that you have to use a numbing eye drop.
That's right.
So no more comment on that until and unless I can have a good number of patients where I can just see that, okay, they were comfortable without it. They had no sensation. And there are some patients who wanted to use it so that they can have an effectively feeling of a massage being done on their eyes.
Yeah, that's right. So I think until that, probably we'll have to, I mean, it's good to always have a backup in terms of
right.
With ophthalmologist as well, as you were mentioning that, you can collaborate with ophthalmologist, and I think they can support you in terms of the ability of you or the extent of you using some drugs, and probably then you can work hands in hand with them. And I think that's probably the way forward. Collaborative work is a way forward as well. And if you are very interested, I think advanced certification, if you go in for any advanced certification for drugs, when you are licensed to practice,
Right.
India is not that
Oh.
certification, and there's no law as for now. But I think it's the way to the future, and that could be really useful. Just one last question, Pooja. This was about the eye drops. Again, this is asking which is the preservative-free eye drops which is available in India. Do you have any recommendations?
Yes. If you have a contact lens patient, if you have a lot of specialty contact lens patient and you want to advise them a preservative-free eye drop, easily available in India, for such patient, then definitely we have one which I have been recommending is Sustain Ultra. Sustain Ultra, not the normal Sustain one. And second that I found which was without preservative was Ubri, which I really don't, I have seen now many patients are complaining that they don't find it now, but Ubri was one of the effective one. And the second that I have been advising my patient and I have never seen any compatibility issues in past 6 years with the layer or any such formation is Sustain Ultra. But that is, Sustain Ultra. And with Gentile, in fact, I found many of the patients, they had those white layer or the contact lens. But if you have a Rosque patient, if you have any RGP patient, and you really want to advise them a good eye drop, which they can use freely over contact lens or XL lenses, and they find no complaint with it, then in that case, it is Sustain Ultra. And see, in advanced, we have Restasis, but it does not, see, that is a very advanced level of treatment. But if you want a very within budget, and the patient can use it, and which is easily available over the counter, then it is Sustain, not the normal one, Sustain Ultra.
Great. Okay. So I think, thank you so much, Pooja. With that, we have taken all, I see on the chat.
Thanks to you, and thanks to the entire OLS team for, in fact, inviting me, and this actually gave me a platform to speak on something which is usually, at the present, it's not my specialty. So at least I am happy that I have given very limited information, but I really feel that in times of COVID, where we are struggling, so in that case, people might find this idea useful and they want to have, just inculcate this into their practice. So thanks to you, and thanks to all the attendees who have taken out time on the, on the lazy Sunday to come and attending me as well.
Yeah. So thank you so much, everyone, for attending. And we do have session planned on next weekend. This is going to be on myopia, again, something which is one of the major, I am putting it under ocular disease already, because myopia is becoming kind of an ocular concern, for us because of COVID, whatever is been getting a boom. So we'll be listening to Professor Kovi Naidu, who will be talking about myopia and what are the public health challenges for the profession of optometry. So please do join us if you are interested. It's at the same time as of today at your respective time zones, and it will be on next Sunday. Until then, take care, be safe, and I wish to see you next week. Bye-bye.